Please welcome Dr. Robert Van Boven.
I'm not here to talk about a win. I'm here with a grave message of the fact that hospitals are they're at odds with their mission. It's become so business-oriented, and my naivety that I want to more or less share the lessons learned, because one can argue, is a Pyrrhic victory worth it? I've talked to Jeff Wygand, the fellow who exposed the tobacco industry of Browning, and they made the movie, you recall, The Insider. I've talked to Lois Jensen, where they wrote the book. It was the first class action lawsuit in America for sexual discrimination. They moved the movie North Country with Charlize Theron. I've met and actually I'm friends and testified before Congress with the first whistleblower case that went before the Supreme Court last. We testified in September 14, and he ultimately won his first Supreme Court decision for an air marshal who was fired for talking about how they were cutting out air marshals because of budgetary cuts in the wake of another Al-Qaeda threat. So, and he was basically forced out and lost his job, couldn't get a job for 9 years, went bankrupt, moved his family, his wife and daughters and children into his parents' house, and then 9 years later, he ended up winning a Supreme Court decision. Hooray. So this is not a happy story, but it is a story of lessons learned so that you can have eyes so you don't go through what I went through and am still going through. All right, and so in that regard, I hope it can help you to help our patients, because something's got to give. Maybe it's arming the patients so they can blow the whistle, because the system is built that they view you as a Judas, as someone who's biting the hands that feed them, a betrayer, you're a snitch. The term whistleblower is pejorative. So, I don't know, but let's go forward. Now, I'm trying to be like slow and articulate, but I'm hyperkinetic. I'm a Jimmy John's sandwich employee, okay? We're gonna be flying through slides here because I want you to get the gestalt. And then at the end, we can tie it together. And there's a lot of, and what I like to do is say, don't believe a word I said, but rather see if I've got the facts to back it up. And that's why I have never lost. So we'll talk about credibility, because ultimately it's all about your credibility. And the other thing is, Proverbs, it's better for others to speak highly of you than you of yourself. Remember that too. All right, so Malcolm Gladwell, great book called David versus Goliath. He speaks the story, Goliath didn't have a chance. This guy had acromegaly, lens ectopia, and he was, really couldn't see much. He was slow and big and a couple 100 pounds of armor. David, he was a sniper, taking out lions with a stone. Goliath didn't stand a chance. So the idea is you have to think unorthodox on these battles. They have rules, like their lawyer can't talk to you, but that doesn't stop from you harassing them, for example. So you got to take advantage of things that they can't do that you can do. It's guerrilla warfare. It's how Americans beat the Brits. It's how Viet Cong beat us. Unorthodox. Know the rules better than they do, so that when they come and talk to you about your employment contract and try to fire you under false pretenses, you can rebut them and bury them. When they make a false report to the National Practitioner Database, work and use the media. I had the media hound the VA, and this for illicit attempts to do smear my name. The media caused a retraction within 24 hours. I didn't have to call a lawyer. So you know, the issue is that you got to think unorthodox, because the light kills the mildew, and that's what big bureaucracies hate and big hospitals hate. Light. So we have a mission as doctors to also not only protect them from harm, but injustice. And I think that this is a bigger injustice. We've got a real problem. The death rate from hospital harm right now, you know, is debatably equivalent every year to all of the US deaths in the whole World War II. I mean, Dr. Johns from Nassau published that in the Journal of Public Safety in 2013, estimating up to 400,000 deaths per year, and 10 times that with morbidity from errors, preventable errors at that. Now, Macri from Hopkins, published in British Medical Journal, you'll see, you know, 2 years later, in May of 15, he ended up showing it's about maybe at least 250,000. So it's more than twice what the IOM estimated, between 60 and 100,000 from 1999. Things are getting worse, not better. The error is human. That's the seminal report from the Institute of Medicine that drew attention to the problem. In 1999, he said, oh my God, it's not acceptable for patients to be harmed like this. We got to do something to change it. But, and they talked about this code of silence. They said, oh, let's do the Public Safety and Quality Improvement Act. That's going to fix everybody and fix everything. The estimate is right there, as it said, you know, between 44,000 and 100,000. So Congress said, we got to fix this. So they have new laws, you know, but laws are kind of like scripture, or more like soap. It's only useful when you apply it. So this law, for example, in Texas, the 161.135 for non-employees, and most doctors are not technically employees. They work for, you know, an affiliate organization, a professional association from the hospital. Well, it turns out this law was placed in Texas in 1999 to protect doctors to report, you know, if they felt there was retaliation for reporting healthcare violations that harm people. There's been not a single case in 19 years where a doctor's been protected by it. I'm hoping to be the first. But the other thing is, you know, the patron saint of Chicago, Al Capone, he said it's always better to be really nice and ask for something with a gun than just to be really nice. So to that end, the hospital, invoking this law, they end up paying 3 settlements to me. In September of 14, settlement 1, backstabbed me, threatened to sue again on this, paid a second settlement in May of 15, backstabbed me, called the cops. Then I finally sued them, never went to court. They paid settlement number 3 in August of 16. So they paid 3 settlements and not chump change. But after the last one, they called the cops again and actually got a false arrest. So sued the cops, got a settlement from them. And now I'm going back for settlement number 4 with the hospital. So I'm not done. All right. Now this is and again, I was backed into this. As was alluded to, I went 4 years of college, 4 years of Hopkins postdoc, 2 years of clinical neuroscience and clinical anesthesia at the Shock Trauma Center, then 4 years of medical school, then 4 years of internship and residency at Harvard's Beth Israel and Northwestern, and then 3 more years in a neuroimaging fellowship at the NIH, and then another year clinical neurophysiology under Austin Sumners at LSU. Do the math. I wasn't growing up and studying to become a litigator. All right. So, PISQA, here it is. Great, they're gonna fix things, we thought. It really doesn't do squat. And so, you know, it turns out they were gonna cut down on the death rate. Well, what's the proof? What they ended up doing is they said, my goodness, we're gonna cut the numbers, but what has happened? RAND did a study of over 1,000 hospitals and compared when PISQA was kicked in 2005 versus reporting. You know, is it helping to bring people out to speak about injury and to improve quality? So they said, hey, we're going to do a nice comparative study of over 1,000 hospitals in 05 and 09 and compare the difference about the behavior in hospital. Do people feel protected? Are they being more honest? When they mess up, are they fessing up? To err is human, but the cover-up is the crime. Well, guess what? The staff don't feel things are dramatically better. So only a third, in 2005, felt that a hospital is a supportive environment for reporting problems. In 2009, it's 36%. Not big. It turns out that doctors are intimidated. It turns out that if you said, well, in 85% of hospitals, here we are, for 85% of hospitals, doctors make 0 or only a few reports. That's in 2005. In 2009, behavior, no change. Doctors are most silent because they have the most to lose economically. They are the least likely of all groups to make the reports. What about the people that are reporting, nurses and the other folks? Well, it turns out 88% of the time, they didn't even know it was an error. I mean, you can't have you need the pilot to talk about why the plane crashed, the doctors. The second thing is, it turns out, this is scary, that if a patient wasn't harmed and it was an error, about half won't report it. This is over 1,000 hospitals across America. But if someone's actually harmed, the percentage of people that won't talk goes up to 60%. That's scary. Now, then they took another survey in 2012 and saying, well, what do you find here in terms of how we're going to help people and have a better safety culture? This is 2 years later after that RAND report. Well, they found that, unfortunately, things aren't so good. It turns out 44%, only 44% feel like that a hospital won't punish them. In other words, more people feel that if they report, they'll be punished. It turns out that less than half feel that proper communication is given, when you have a shift change to protect patients. And it turns out that about 56% felt there was enough staff. Is that a culture of safety? So, the notion is we should practice what we preach. It turns out everyone says, of course we should disclose all adverse events and errors, but it's only happening 30% of the time. Fear, embarrassment, and distress are the frequent mentioned reasons. Common human nature. Now, we got this dilemma of the Hippocratic Oath versus a career. So, the British Medical Journal speaks about doctors, and bottom line is they said, look, they're afraid of losing their job, their posts, and so on, and the outcome is that they feel quite futile. It's a syndrome. I think it's an epidemic. But that those who cannot report the past or do not report the past or the report are condemned to repeat it. I mean, you have to learn from the errors. And so the numbers on the hospital errors and causing death have climbed. They're not going down since PISQA, which was designed to improve safety and reporting, to cut the errors down. So we got a system at odds, and there's John James talking about 400,000, 10 times in terms of injured every year, including his son in Houston. Now here, the Macri study from British Medical Journal, 250,000. Number 3 behind heart disease and cancer. And he goes on and talks about what are the key things? Well, you got to make the errors visible. You got to talk about it. You got to have safety programs. You got to reward people to speak out. Good luck. Because the whistleblower, even though it comes from good origins, either the bobbies, the police, and or a good referee at a game, if he's good at it, it's become pejorative. And so now the tools of the trade, the strategies of war, I think that you got to know the rules of engagement. It's funny, I learned it from the VA, and it's classic. You deny, you downplay, they deny, they downplay, they discredit, then they disparage. And then they say, well, of course it wasn't motives, because you didn't meet the but for, because you were still bad. The but for meaning there was another excuse. Okay? So you got to know your rights, you got to know the rules better than they do. And so when I speak about disruptive, there should be a causal link in terms of something that increases the risk of patient care. But now the other thing that I found in my case, was that the hospital ended up, they tried to get the peers, and the peers refused them. Because they ended up, basically, you develop good relationships, and you hate the sin but not the sinner. In other words, if you had a dispute with someone, you keep it not personal, like you were saying, keep friends. And they rallied behind me, and they said, we're not going to do a medical executive committee on him. So the out-of-town lawyer who was, quote, the acting chair of the board, who was the counsel to the board, who also was an investor for the hospital, little conflict there, he ended up usurping the medical staff bylaws and rules, and forget about, the HICWA, and in terms of your rules and rights. And he summarily said, oh, you're suspended and no trespass order issued, and called the police on me. So I said, oh, thank you. That's going to be settlement number 3. And it was. But so in terms of surrogate, they'll have surrogate strategy, and I just alluded to one of them, using the police. Now, you're going to love this, because I told you, remember, don't take my word for anything.
He's been,
Okay, here we go.
for 8 months, reporting as many incidents as he could think of to CMS, to the United States, to Texas Department of Health. And each one of those incidents, we have validated that there were no issues.
Yeah.
We have letters after letters after letters.
But it still costs a lot of money and a lot of time.
Resources.
Yeah.
And so what happened was, we got to the point where the Attorney General said, okay, we've had enough, we can't take any more, we will pay you this amount of money.
That was a week after settlement, number 2, where they rescinded and expunged the no trespass order that board of manager did. It was part of the settlement to eliminate that. They then called the police saying that I was in an ER visiting a stranger, which was a patient of mine, and I wasn't supposed to be there. And this chief administrative officer was complaining to the police officer about how I'm making all these reports of violations, and they had enough and they couldn't take it anymore. And she said, and none of them were valid. And the policeman said, oh, that's really terrible. Yeah, that was Barney Fife. Now 3 months later, after I filed the lawsuit, now she changes the story, and she's saying, oh, well, all of those reports were valid. I was part of the team that had to correct them with CMS and the state, but I have no idea that he made them. Go ahead.
For that, there were
Deposition.
multiple visits from CMS.
And weren't there a statement of deficiencies created and issued to LRMC in 2015?
In 2015, before April 1st?
No, I'm asking you, anytime in 2015.
Yes.
Were you part of the LRMC team that was creating the provider's plan of correction?
I was.
Do you understand that this is in response to Dr. Van Boven's reports of violations at LRMC?
There is no way to know that.
I remember she just told the cop 3
What
months
about
earlier.
the fact that the complaints are related to failure to perform neurological assessments?
You could make that assumption.
Okay, because he's
But-
the only neurologist on staff at that time, correct?
Yes.
That was a
His orders that weren't
TIA.
complied with, as listed in the statement of deficiencies, would show the doctor's order that wasn't complied with, correct?
It would show which physician orders were not complied with.
So if Dr. Van Boven is the neurologist that was making these orders that weren't complied with, that would also be additional information that would lead you to believe that maybe he was the one reporting the violation.
I don't know how the two are tied together, because whenever we get, it could be a family member that makes that complaint to the Department of,
How would the family member
Human.
know whether or not the nurse is
Whether-
complying with the doctor's order? Are you aware or not of whether or not Dr. Van Boven has made complaints of violations by LRMC?
there is no way that I would know for a fact that he made these complaints.
So the upshot there is that it's good to have an unintelligent enemy. Okay. Now the next thing is, so they pay the settlement again. Okay. The third settlement, August 31st. They go belly up. They default on a $167 million HUD loan. They sell to a big conglomerate, but keep the same management. They just changed their hats. You know, it's kind of like the KKK the night before and then the morning after. And they signed the settlement rescinding the no trespass order again and pay another whopping settlement. But then they call the cops and say, we thought we saw him here yesterday. New company, but we saw him and he was at this building. Though there's no trespass order at that building, but let's set up a new one so that if he comes back, we can then kick his ass and throw him in jail. So this is Diddle D and Diddle Dum talking to the Barney Fife. Go ahead.
As far as any officer is concerned, that's part of the address. So that's part of the address here, as far as I'm concerned. The whole address. That's what I'm saying. It doesn't have its own address. It's part of this address.
But the MOB does have its own address, and I don't care.
Yeah.
Does he know that?
I'm looking at the back road.
Maybe he doesn't know whether or not we got a no trespass there.
But
I'm going to put it out there.
well, that's
a
the
real
thing.
honest guy.
That's the thing too. Just like you talking about how smart the guy is. He's one who tries splitting hairs. You know, going, well, it's the grass right here, or is this, or there's an easement. And that's what I'm going to tell these guys because he does do that. He does do that. And we don't need to wear out there and call 20 minutes. Yeah. You know, if
He
that's
shows
it,
up anyway.
that's what's going to
We'll get
happen.
going. Let them do it. Because I'm sure he'll say, I'm stupid, and they'll cut him and drag him.
Yeah, well, I mean, it's just like if one of the officers here came up to him and was, well, wait a minute, where are you going? That's assault. You just assaulted me. What? So. Oh, well.
Speaking of troublemakers.
Yeah.
We're going to get back here. We'll get with Steve.
All right. Thank you.
Appreciate it, that taking care of it.
Steve, thank you.
Yeah, sure.
So he's demonstrating how he's going to kick me.
Don't kick it too hard.
Don't kick him too hard. You'll lose your shoe.
You might lose your shoe.
Okay, see, these are the intellectual giants that run a hospital.
Hey, Carol. Hey, mate. Give me a holler, and I'll
And they
explain
set
to you
up-
what we're doing with, for your staff here first.
So then they set the entrapment to tell the staff to watch for him. Next time he comes, 5 days later, they don't give me notice.
I'm going to put it out there.
And I just want to let you,
That's the thing too, just like you talking about how
You're saying-
smart the guy is.
we don't have a no trespass order, but maybe he doesn't know that building, that we don't have it against him, so we can get him. All right, so then what we'll do is, then we go to the arrest. Here's the drama. Okay, so next, the cops, 5 days later, everyone knows but me that they have a brand new no trespass order, and this is a week after settlement. The police come, the same guy, 5 days later, and he says, listen,
This could be one of those situations where do as I say and not as I do.
do as I say, not as I do. We're going to bust him illegally. And then she says, let's make sure you cuff him before he tries to run.
I was here with on the good faith that as part of this settlement, all of that crap was eliminated, but now that you've advised me otherwise, be very happy, because I have a lot of respect for the police department in general. Oh, I do. And she can attest to that. And as Chief Radford can. So I would absolutely honor this request, not only to leave, but to look forward to receiving this no trespass notice. Now, let me say, it's obviously an egregious thing, because in case you didn't know, I'm a healer, I'm a doctor, I take care of patients. And so to have the most defaming thing for doctors to say you have a no trespass order from going to visit a patient of yours or a friend of yours in the hospital, it's egregious. So there'll be more litigation coming out of this, okay? That again, you'll maybe, who knows how many months, I'll show you the newest one of it being rescinded and settlement achieved. But in the interim, absolutely will honor your request, okay? So I'm leaving.
Hold on.
what we're trying to do. Okay, this is what I was trying to explain earlier, okay? I know. Answer that. Right, that's Detective Howell with the PD. So, all we're trying to do, okay, since it is Baylor Scott and White now instead of Bay Regional Medical Center, that's why I wanted to take you down there. I'm not taking anywhere. I'm not. I'm leaving. And they can mail me the no trespass order. Period.
Know your
I'm
rights.
not taking down anywhere. I'm talking about through the security office, right? Shit. Would you stop? I'm not going anywhere except out and
One of
leaving.
them takes sequestering me into a security office with all these administrators.
Do you want a notice or not?
Unlawfully.
I can have you a notice right now. You know what?
I can have you a notice.
Certified. I've already taken, like I said, if you were listening, I've already established that I will accept at face value that there is a new de novo
Verbal notice
I want you to
is
listen
in
to
accord
me.
with the law.
If you understand what needs to happen.
You need no written notice.
What needs to happen
Know
is that
the
you
law.
should send me the notice and provide that notice. Send it to my office, send it to my home. I'm leaving. And you're not leaving until I tell you. You know what? You know what? I committed no crime, so do not threaten me. Right now, what? You are committing criminal trespass. You know what? I'm not. Security had to come up and get you to try and leave. Look, I'd never committed a criminal trespass because there was no criminal trespass issued. So you can't be in violation. Are you remaining in a facility that they have asked you to leave? No, I'm leaving. He asked me to leave, so do not push me. I'm leaving the facility. Stop. He asked me to leave the facility. So I'm talking to you right now. You know what? Dr. Van Boven? Yes, it is on camera. I'm supposed to be off of this train. Run your back.
Okay, so the circular argument was, okay, now why am I being arrested? Because you resisted arrest. And I said, well, that's a circular argument, and you know, I got a vacuous appearance out of him. Anyway, so months later, the prosecutor looked at the videos, immediately rejected the charges and the cases, and then I sued them and brought him the mediation, and he paid settlement. Now, okay, I'll just move. So now, so what you see here are not one, not two, not three, 6 independent, on-site, unannounced investigations pursuant to my reports of patient deaths and harm and injuries that spanned a year and a half. After 2.5 years, no one listening in-house, but trying to retaliate, I finally took off the gloves. So in June, it was June, October, November, May, you know, through the next year, 6 times. Each time, I was substantiated, verified complaints. In fact, again, do your homework. Find out what is objectively against the law, not your opinion on a decision, clinical decision that doesn't constitute a violation. You don't cry wolf. You get credibility. You make it airtight, and you win every time. So here's the federal deficiencies, just tons of them. 1 out of 4 nurses didn't have the qualifications to do their job. 6 out of 20 patients had serious problems in terms of not getting quality care. ER patients being sent home with strokes. It just goes on and on. Cover-ups, doing a quote root cause analysis after a death 4.5 months later because I would not stop hounding them to do it. That's a violation. They're supposed to do it in 10 days. That gets to one of the tips is the parable of the persistent widow. The judge didn't want to give justice. Judge didn't believe in God, but she never went away until he finally gave up and said, my God, she's gonna beat me. I better deliver justice because she'll never go away. And so the message is never, never, never give up, like Churchill. And the other thing is when you're going through hell, you keep going. So there's the false report. When she was telling a policeman back in 15, oh, my goodness, those people never asked for him. He had no affiliation, he violated. On the right, you see their affidavit saying, false. We asked him to help. He saved my husband. I knew he could help me. Here, right before a settlement, I can't keep track which one. That was between the second and third. Yeah, weeks between the third, and weeks before the actual arrest. They said, look, you got to give us a discount. You're going to need to identify, and then retract the complaints you made and agree to stop making reports on us. And then they also argued, my goodness, we already paid you $500,000. We need to give a discount for our repeated offense. It's from their lawyer. All right. Now, and then they got really dirty. They sent 15 things in a surreptitious, counter complaint from people who were incriminated in the errors that they were whining about, completely specious. My peers in the medical executive committee uniformly tossed it and said, there's nothing here. The emperor's wearing a robe. So this out-of-town lawyer, investor, tossed it to the Texas Medical Board, and they dutifully initiated their own complaint against me based on bad faith reporting. So, and that was despite the fact that the director of human resources wrote to the Texas Medical Board by affidavit saying, I saw this guy come in, pull this file, it's not a peer review file. He removed anything that was exculpatory and only sent you the selective stuff and then falsely attested that it's all true and complete and it's a peer review. Then I got slapped and attacked for not reporting a peer review disciplinary action against me. That never occurred. I felt like Alice in Wonderland. I mean, it was crazy. Now here, this is the other key. Never make it personal. The CEO, who the out-of-town investors tried to fire me in 2013, I just very politely and respectfully said, you're wrong, sir. The contract shows I haven't breached anything. And I had just testified before Congress and defeated the VA. So he turned around and, he said, I'm not going to go for this because this is out-of-town micromanaging by big business folks. And that's where it's going, corporate medicine. And he said, I'm not going to play this game. He wrote a letter saying these were bad faith reports. He's never had a peer review. The CEO of the hospital became my friend. The point is, so don't make enemies, speak the truth, and don't make it personal. And then you can have friends. So here's the act, says, oh, no bad faith. Here's their response. We don't care about motives, only the facts, i.e. false facts, bearing false witness, lunacy. Here's from their general counsel. We're not going to be looking at motives, and we think that you got full due process, and we got this affidavit saying everything they gave was legitimate, so we don't care about the other affidavit. Incredible double standards. Double standards in terms of, and then, relitigating. They end up two strange cases, 3 weeks apart, after 27 years, a dentist and physician, of Lakeway affiliates coming up with some sexual boundary violations, and one of them was thrown out. The other one they sat on for more than 6 months, and when I end up complaining that they were trying to attack me in complicity with working with the hospital as a surrogate, while I'm suing them for quality care, that they wanted me to say that some of the cases of the 15 I violated standard care. I said, no way, I won't compromise, no way, no remediation plan. And then I reported them to the Rangers for criminal prosecutorial conduct. I reported them to the Senate. I reported them to the House. I reported them to the Texas Medical Association. And then suddenly, they called it an emergency. I was a threat to public safety. So, no active supervision of the Texas Medical Board. The teledocs showed that, and along the short of it, get these stats. A key performance measure includes they have a target, a quota, of disciplining at least 12% of any complaints against doctors. Not truth, quota. 1 out of 5 are initiated by themselves, so a little conflict of interest, you initiate a complaint, you got to save face. The revenues have increased by 350% since tort reform. They're making a lot of money for the state. It's everyone taking care of each other. 60% now of all expenditures are all about enforcement. Timeline, bottom line is, these little blue dots are all these visits by the DSHS that substantiated things here. These are the, quote, the two claimed, one of them, this one, tried to shake me down for $30,000 extortion for silence, which I refused, this patient A person. And then she waited 3.5 months and learned about my lawsuit and then tried to shake me down. Here, the other person, again, hers was vetted by the informal settlement comps, thrown out in November. Here in February, after this slew of reports against the staff of the board, suddenly the sky was falling and I'm imminent threat to danger to the public. A year and a half later of being restricted my license and portrayed as a monster for my 15-year-old daughter to learn about, that daddy can't see women because he's a monster. And my wife of 16 years had to deal with that in a small Mayberry RFD town. The judge finally threw out all of it. Threw out all that 15 cases, threw out these 2, gone. But now the board staff filed for exceptions, and who knows if they're going to try to, appeal to district court. They lost big time at the state office before the judge. And unfortunately, while all that's going on, I'm still restricted, even though it was deemed, all of them were deemed unsubstantiated by the judge. So, bottom line is, do right and risk the consequences. Sounds good, But you can see what sometimes can happen. You did the right thing, whistleblower. So naturally, of course, we have to fire you. Goodbye. And then the other gentleman, I'm sensing confidence, boldness, and moral sensibility. You're not going to turn into a whistleblower, are you? Credibility. You remember Sergeant Friday. Just the facts, ma'am. But to make sure they're facts, make sure it's an actual violation that matters. Be your own harshest critic, your own devil's advocate. Relentlessly search for your own prejudices. We all think that we're the best thing since apple pie. I think I'm more handsome than any movie star. We're a little warped in our perceptions. So denial is illusory. Find sage counsel. But check but verify. I mean, don't put your trust in any lawyer by yourself. And advisors, there's nothing, 2 people that always agree, 1 is unnecessary. You gotta find a friend who's a tough critic. And as Hippocrates has observed, you gotta remember when it gets to medicine, experience is fallacious and judgment is difficult. So you gotta study and restudy and say, now where have I not thought of in terms of angles and strategy? You gotta out-hustle these bureaucrats that punch in the clock 9 to 5 and work 40 hours a week. And you remember, you gotta hate the sin but not the sinner, because critics can convert. And remember, if you got your facts right, the truth will endure. Now the question is, will you prevail, or will you get posthumous praise and have them deal with the stench of your corpse? I'm hoping not the latter. We'll see. But when you do it, when you do argue your case, no hyperboles, no personal attacks, no adjectives, and no conclusions. Don't tell people what they should think and what they should conclude. Let the facts draw them out. Ergo, the critical need to stand on solid ground. Remember that light kills mudo. Here's the strategy. Sir, if you have any concerns about your treatment and you want something done about it, just call the BBC watchdog program. The idea is you got to arm your patients to protect themselves, because no one cares more about your patients than your patients. So educate them. And work with the media. Because a newspaper is not just for reporting, as it is, but to make people mad enough to do something about it. Use the media. They're their friends. And the main thing you got to do with them is tell them the truth. Don't hide anything. Show them you're credible. They'll work with you. And that's it.